We are your vaccine authority here at Eyewitness News, and we are getting a lot of questions from you at home. So we are taking them right to the experts each and every day. And today, Dr. Summer McGee, the Dean of the School of Health Sciences at the University of New Haven, is joining us again. Dr. McGee, good to see you. Thank you.
Thank you so much for having me back.
Before I get to the question, can I ask you, when you hear that the numbers, the positivity rate has ticked up right there, now almost 5%, does that concern you?
It does concern me. I'm concerned that we're seeing a St. Patrick's Day effect and that we may also be seeing some early effects of reopening and some of those variants that are taking hold in our community. So it's definitely a reason for concern, and everyone should be extra vigilant until we can start to see those numbers go down.
All right, good thing to keep in mind. Let me get to our first question right here. Someone wrote in and said, if you had the virus in the past year, should you still get the vaccine?
Absolutely. What the evidence shows is that you get an additional immunity boost from getting that COVID-19 vaccine. Natural immunity is good, but having an additional exposure through vaccination is even better to really boost that immunity even higher. So if you've had COVID-19 recently, as long as you're no longer symptomatic and you're feeling fine, you should go ahead and get that shot to get that extra level of protection.
All right, a good message right there for sure. Now, April said, if you received your first COVID shot and had no severe allergic reaction, is it possible to have a severe reaction to the second one?
It certainly could be possible, but really what we look for is a history of allergic reaction in individuals. And that's where we try to make sure that they have additional time to wait to make sure that no reactions happen. It's much less likely if you didn't have an allergic reaction in the first dose that you would have one on the second. But that's why we have everybody wait 15 minutes after they get either dose to make sure that no adverse reactions take place and that you're fine to resume normal activity.
I had my shot on Saturday. I just had a sore arm. It wasn't too bad. That was the first one, so I feel better already. Our last question this afternoon, if I'm on antibiotics and I'm curious to know if it's okay to get the vaccine.
It is okay to get the vaccine if you're on antibiotics. It's perfectly fine. The specific CDC guidance says if you're taking other medications, there's no other contraindications. So unless you're feeling extremely ill and you're under the care of a physician, there really isn't anything preventing you from getting that shot in your arm. So don't delay. Take advantage of any opportunity you have if you're eligible to get that shot. Things like antibiotics or even a little cold or a sniffle shouldn't have you delay your appointment.
I was going to say no reason to stop, that's for sure, or at least to not get that shot.
That's right. Absolutely.
Okay, Dr. Summer McGee, thank you very much for joining us again this afternoon. Always good to see you.
You too.